Yep.
All right, I'll log on.
Awesome.
Okay, bye.
So am I joining? Please click the link to join the webinar. That's for the actual.
Yeah. So if you join, I'll just click on you when you're in. All right. Good evening, everyone, and welcome to the IRG Total Golf Approach webinar. I know I speak for myself. I'm Darren. Right here, the guy next to me is Tyler, and we're both providers and PTAs at IRG Physical and Hand Therapy. Combined together, we have about 13 years of clinical experience, and we both went and furthered our education. And we got TPI certified. So TPI is the Titleist Performance Institute down in Oceanside, California. And it was founded with the goal of really focusing on golf, right, and how the body connects with golf and everything like that. So today's webinar is going to cover how your body connects to the golf swing, how the golf swing connects to your body, and so on and so forth. And then we're also going to cover power, right? Some keys we can kind of take from the people that hit the ball the longest in the world, and some kind of swing characteristics that they exhibit that can also help us kind of, hit the ball a little further in our own game. So I'm gonna go ahead and hand over to Tyler here, and he's gonna go ahead and start you off.
Cool, guys. Well, welcome. We're excited to spend a little bit of time with you guys and just help you guys educate you on kind of some of the fundamental basics of golf. Over COVID, we've noticed just a great increase of golfers. Since they had a lot of downtime, golf was definitely a social distancing sport that you can spend and play. So with that, we kind of noticed a lot of things happening, a lot more injuries, golf-specific injuries, and a lot of clients coming in and coming out, telling us that they got injured due to golf or playing golf. And we're realizing that a lot of these people don't have instructions. They don't have the correct posture, they don't have the correct grip, they don't have the correct stance or transformational zones, or being able to get into those transformational zones. So we're seeing that because just being COVID, that a lot of people are sitting at home and they're getting bored, and then they just go out and play golf, or they get off work from a desk working from home. They figure out that they just want to go out and then do these ballistic movements, which is a golf swing, right? So that transition from sedentary to a ballistic movement doesn't really work unless if you train properly. So, just the incorrect body mechanics of the golf swing. People don't have the range of motion that they need to get into to get the correct sequencing down. Sequencing is huge for the golf swing. And then just, the range of motion that they don't have, or the stabilization that they don't have, which allows them to make a proper swing. So with this, Darren and I both have continuing education on TPI, which he said was Titleist Performance Institute. It really breaks down everything that, a provider would need to know about the golf swing and how to make the golf swing efficient and effective for you. We also took furthering education and got Nike certified, which is a functional specialist certification for golf. Really enjoyed that, and just, again, educated us on the proper body mechanics that you need to have an effective and safe swing without injuries. Darren and I, as he mentioned before, have been PTAs. We have 13 years combined of physical therapy and just body recognition and understanding of motor control and movement patterns. So with that, just understanding how to make a golf swing efficient and effective is really, really important, right? We see a lot of people feeling like they need to have a Tiger Woods swing. Your swing is your own swing, and it doesn't have to look like Tiger Woods swing. You need to make your swing the most efficient. You need to have correct mobility. You need to have correct stability and power along with sequencing. If you don't have any of those, none of those are going to be repeatable or reliable. Also creating consistency, which is the number one thing about golf, right? You want to make sure you have a really consistent swing that has the correct mobility, that has the stability, that has the power and sequencing. So along with that, you know, we want to make sure the number one goal is that you're pain free. You know, we don't want you going on the golf course and just getting through golf. We want you to enjoy golf without having to worry about back or knee or hip problems. So with that, you know, we strongly believe that you need to move well before you move often. That's so critical, that your joints are moving properly, your muscles are warmed up, and you have, you know, all this correct movement patterns and just the right motor control before you go out and play again. So with that, you know, so proper warm up is huge. You got to make sure that your joints are lubricated, your muscles are warmed up, and you know, yeah, you're lubricated, loose, warm muscles, and whatnot. Along with that, you got to make sure you understand the correct movement patterns and motor control of your body before you go out and swing a golf club. Golfing is a very dynamic sport. It asks a lot of your body, rotationally, flexion, extension, side bending, and all that stuff. So you got to make sure that you understand the correct movement patterns before you go. So what do they have in common? As you see, some of the greatest players right here, you have Ricky Fowler, Dustin Johnson, Matt Wolff. Their swings look completely different, but they do have something similar and very in common, which is sequencing. Sequencing is the most efficient movement pattern for the body to create the most reliable, powerful, and consistent swing. The sequencing comes from your hips to your thoracic, from your arms to your club. I like to use an analogy back in the day where you did this little thing where you had a jump rope and the person on the inside held one end of the jump rope and the person at the very end of the jump rope was running around as the person on the inside was just moving very, very slow. Again, that's kind of what we like to think about when you have your sequencing. The hips are going to move slower than the club, but the hips generate that sequence. Kinematic sequence is the build up on the previous segment, increasing speed up the chain. Again, kind of that jump rope analogy. Sequencing is going to create the most maximum energy transfer for the swing, to create that power, create that distance, to create the consistency that we all look for. Again, to understand that motor control, sequencing really breaks down that timing and coordination and the synergy with all those muscles and the movements that go on with your body. So it's very important to kind of understand that the sequencing is what drives the golf swing. 99% of the people can't even get into the positions that PGA players do, yet they try to go out and replicate that from a sedentary lifestyle or from a desk job or whatever it may be, that, you know, they kind of just get up and they try to have this beautiful swing. But if they don't have that mobility, if they don't have that stability, if they don't have that sequencing, then that's where we see a lot of pains or injuries come about. So the most important thing is efficiency, not your swing style. Your swing style, it doesn't have to look beautiful or pretty or like a Tiger Woods. It just has to be efficient to create the best player. So with that, good sequencing is the key to good golf, pain-free golf, and power. As you can see here, your body's made up of mobile and stable joints, kind of going on that sequencing. Your body's not going to be able to move properly through the golf swing if you have a hitch in a joint, or if your joint's not moving properly, or your stable joint is moving too much. For example, you have some mobile and stable joints. Your ankle is a mobile joint because it moves in a circular motion, right? It moves in multi-planes. It just doesn't bend forward and back. And then that's also kind of attached to a knee, which does just move in one plane of motion, flexion and extension. Let's say that ankle isn't moving properly or isn't able to rotate the way it needs to. What happens is that knee starts to really kind of compensate for that motion that ankle is not producing. And hence, that's where we get a lot of these injuries that we're seeing. Along with the hips, the lumbar, the thoracic, it's just a stable joint connect to a mobile joint, connect to a stable joint. So we just got to make sure all those are moving properly and efficiently. Mobility is key, right? It's how your body moves. You have to increase your mobility before you start the sequencing. That's just so huge. And yeah, mobility is the ability to move or be moved freely and easily. Like your arm is going to move in many motions, but if that doesn't move the way you want to, then it's not going to move properly. And to get that mobility, it's important to, figure out what or how to combat that. So if, again, like people who sit at desks or coming off a couch after long periods of times, they're going to have muscles that do become short and tightened, or some other muscles that are going to be loose and very long. So again, kind of what we do is we kind of see where those muscles are, or those compensations are happening, or those short muscles are happening, and we can attack those and help those produce more efficient muscle. Hypermobility, it's not you. If you have a really tight hypermobile joint or muscles, then you're not going to be able to move those muscles or those movements properly. Mobility allows for better efficiency of the joints, so all the joints are not compromised. Again, kind of just realizing that the mobile and stable joints, they all got to move properly in the way they're supposed to effectively. Mobility, if you're moving properly, then there's going to be a lot of reduced stress, which is huge in everything. I mean, if you're super tight and stiff on the golf course, then that's just going to reflect on your golf swing as well. So ability is going to allow you to move universally all over all the planes that they're supposed to, and all the planes of movement for the golf swing. Stability is going to allow that mobile joint to move with a supported muscle or action that mobile joint is going through. For example, your arm just can't go in the air without any stability to keep it where it needs to be. Golf is a very active, stable joint. You're going through all the planes of motion as you're rotating around your stable feet in the ground. So just allowing that stability to compromise and keep your mobility where it needs to be. And then on the lines of that, active stability is the body's mechanism, allowing you to move through that those signals to your brain from the ground and above. Start training properly. So as we've been going through this education, PTA, we understand that there is a very important way to begin your golf hobby, career, whatever it is. There's some very important things that we believe in, and the most important thing is getting connected to a movement specialist or a coach. Again, just going out and just hitting the golf club or swinging a golf club and hoping it looks like Tiger Woods and Dustin Johnson is not going to work. So it's really important that you get connected to a TPI or SFMA, physical therapist, just for them to assess where your swing is at and your body movements are. And if none of those are moving the way they need to properly, then that's where the injuries come from, or those pains come from. So if you kind of get connected with the movement specialist to see really what you need to work on, that's going to help. Is such a valuable thing. Like your body is so important for a longevity of golf, moving, functionality. And that's just something that we really, really believe in and firmly believe in. Golf can be played for many, many years. The mobility and stability, you definitely need to get those down. Really need to understand how to get into those positions, how to get your rotation down, to get your flexion down, to get your side bend down. Instead of just going out there and whacking the ball, you need to move properly before you move often. Again, you need to get into all those motions. It's super important just to understand that this hobby sport activity is a multi-planed sport. You're using almost every muscle that you can to swing a golf club. So just making sure that you understand the importance of what it takes to create a great, efficient golf swing is very important. And that's what TPI specialists can introduce to you. So with that, we have some screens that we can, as you see here, some screens that we do. We have a TPI screen, which is just an overall assessment, kind of just gives us a baseline of where you stand. This is not going to really give us a lot of information on how to radically increase your strength or conditioning, but this just gives us a great baseline. And then we also have an SFMA. This is going to be for the pain golfers who come in and say I have low back pain or I have a hip pain, whatever. Then we can kind of diagnose where that pain is, and then we can progress from there. Fitness also just gives us the idea of where leaks are in the athlete's body to really utilize all their energy. And then we also have power, which is a baseline of how much power you have and then where we can go from there. And then lastly, this helps us all design and build a program specifically for you. So with that, I'm going to send it back over to Darren, and he's going to go through some power stuff with you.
All right, thank you, Tyler. So, starting off with power, this is a picture of our man Kyle Berkshire. So Kyle Berkshire is currently the world long drive champion. He hits the golf ball further than anyone on the planet. So, power. In the words of Phil Mickelson, just hitting bombs, right? Just driving it past your friends, hitting the ball as far as you can. And we're going to kind of dive into what we're going to start the PGA Tour, what it means for professionals, right? Why you see such a huge focus nowadays on hitting the ball further, right? Everyone knows Bryson DeChambeau and Tony Finau, and those guys are approaching about 200 miles an hour ball speed, which 5-6 years ago, that's unheard of, right? I mean, these long drive guys have 205, 206 ball speed. So why are the guys in the PGA Tour making such a concerted effort to hit the ball further? There's a lot of data to actually support that notion, right? So here's the best graph. This is over an 11-year period, and this is a representation of average money won in the PGA Tour per year comparative to ball speed. So as you can see in this graph, as ball speed goes up, so is the money you win, right? And from a strokes gain perspective, there's a lot of data to support this fact. Now, obviously, there's a couple outliers there, here or there. Those guys probably aren't good putters, but there's also another little graph here, and talking about just the average or the guys on the PGA Tour that have above an average of 170 ball speed. So 170 ball speed is kind of like the number, right? So if you can hit at about 170 miles an hour, you can probably drive it over 300 yards, right? All things the same, talking about elevation, humidity, all that fun stuff. But in the last 10 years, or the number of guys who average over 170 has more than doubled, right? And that's not necessarily a product of equipment. So the middle of that club face, the middle of a driver, has been optimized for 15 years, right? There's rules of golf that limit how fast that ball can come off the middle of the face of the club. So why? Why has speed increased so exponentially on the PGA Tour in the last 10 years? It's really because from a strokes gain perspective, there is a very large advantage to hitting the ball further, right? You hit the ball further, you get better scores, right? So if you add 30 yards onto your drive, that's 3 less clubs. And most golfers are going to hit it closer with a pitching wedge than they are going to hit with a 7-iron, right? So we're going to kind of get into some nerd stuff here and some math, right? So I did there's a little breakdown, a lot of statistics that are going to come at you, but we're recording this, so if any time we can circle back to it, the questions at the end too, if I go too fast. So here we go. So what's smash factor, right? You've probably heard the term smash factor before. Smash factor is ball speed divided by club head speed. So, right, so how fast the ball came off the face versus how fast that club head was moving, okay? So modern equipment and the rules of golf allow for about a maximum of 1.45 to about 1.5 in smash factor. Okay, so here's a little example. So 1.5 smash factor is going to be a club head moving about 100 miles an hour, right? So I think about average adult male club head speed is about 100 miles an hour on average across the entire span. So that means if you're hitting it right in the middle, right now to the toe or the heel, if you're hitting it right in the center of the club face, you made a really good swing, you can probably expect a ball speed of about 150 miles an hour coming out of that club, right? And that's pretty fast. So what if I told you that a recent study on the PGA Tour found out that for every 3 yards you hit it further, right? So every 3 yards you gain in driving distance, you can afford from a strokes gain driving perspective. It's a large equation that I don't even understand, but you can afford to hit it 1 yard further left or right of center. So for every 3 yards, you get an average error of 1 extra yard left or right. And that's exponentially compounded when you start talking about the amateur golfer, right? So you're talking about a golfer, let's say the average handicap is 15, okay? So if a 15 handicap golfer gains 3 yards of distance, they can afford, on average, to hit it 2 yards further left or right. So 2 yards more crooked for every 3 yards you gain, okay? So now let's say you did a 12-week program with Tyler and I. We worked on speed, right? You came in pain-free, and we diagnosed you. We did a power screen, diagnosed you, and was like, okay, we're going to work on speed. We can get you faster. We can get you stronger. Let's say in that over the summer, right? So let's call it 12-week period. You picked up about 10 miles an hour of club head speed. And for a person who has never worked on club head speed before or never specifically trained for it, 10 miles an hour, 10%, is definitely feasible. It's definitely doable. It's a large jump, but it's doable. So let's say now you're swinging 110, right? We're still hitting in the middle of the face. You can expect that equation to have a ball speed of about 165 miles an hour coming off that club head. Okay, and that's really high. It's really good. So that's an average of 15 miles an hour. Okay, so what if I told you that statistically speaking, all things equal, 1 mile an hour increase in ball speed equals 2 yards distance, right? So if you pick up a mile an hour ball speed, you can expect on a TrackMan or a Foresight launch monitor to hit the ball about 2 yards further carry distance. So that's 30 more yards. So if you pick up 10 miles an hour club head speed, still hit out of the middle, you're picking up 30 yards of distance, which for a lot of guys, that's 3 clubs. That's a huge difference, right? And now reverting back to 3 yards further, 2 yards more crooked, right? If we use that same relationship, we can now afford from a strokes gain perspective, not all golf courses, obviously, because a lot of golf courses have water 20 yards of center line. But on the average, strokes gained, you can afford to hit it 20 yards more crooked because you drove it 30 yards further. And that is a huge competitive advantage. And that is why the guys in the tour are all trying to hit the ball a lot further, because it just makes golf easier. You got shorter clubs in and all that fun stuff. So we're going to do a little video analysis here of the guy we talked about in the intro, to Kyle Berkshire. So we're going to click on his video.
This is Kyle Berkshire. He's not just a long drive guy. He actually played golf at North Texas before he transferred to Central Florida for academics. So he's an athlete. He's a smart athlete and clearly fit. And he has one of the most interesting starts to his golf swing. So he sets up, obviously, this left foot here is right, it's up in the air. Right? He's got all his weight in his right foot. He's going to move pronounced to the left, bring his right foot up, and get this sort of rocking motion just to get the whole flow going. Again, back to the power elements. Really strong grip, ball well up. It's important. Most of these long drive guys are going to have their left foot perpendicular to the line. They're set up with a pretty square left foot. If you're looking for more distance out there, I mean, this is literally something everybody can do. They can move up and they can move off of the golf ball. I mean, you may not be as muscular or as tall or as fast as Kyle Berkshire, but you can do that. It doesn't have as much width as you would think, but he's got a lot of momentum going to the right side. Got that up move, incredible amount of shoulder turn. Now here's what he does have though, perhaps some of the highest hands. I don't know how they can get any higher. I mean, you look at how high these hands are. Beautiful move into the right leg. I mean, that is just classic right there. You can't do any better than that. Left heel off the ground, left knee behind the golf ball. Again, he's got a nice little angle here in the right leg. Again, so it's just pushing back that way. He's got a beautiful brace established in that right foot. But look at where these hands are. This is one of the most extreme, high, straight left arm, collapse that whole triangle, that whole structure of the arm structure and the club. Watch how acute the angle gets and watch how this all just collapses down. Look at that. So when he comes down, because that heel is closer to the target, it keeps this left side of the body from spinning out too fast, because you want to go into the ground and you want to jump. If you've spun out, okay, and most of them have this left heel inside the foot line. If you've spun out, you can't elevate as fast or as powerfully. Now you begin to see the elevation here, great angle, incredible angle. And again, using the ball of the foot to elevate this left side of the body. Look at that, completely off the ground. Now it's released. You know, you look at where that heel is. See where the heel is? The foot is perpendicular to the ground, but they're rotating so much. Now you see the whole foot is splayed out like that. That's how fast they're rotating. Up he goes. That's a good move.
All right, so what did we learn from Kyle? I'm never going to tell one of my clients or someone I'm coaching that, hey, let's get you in these positions that Kyle gets into, right? We're talking about a guy who is the best in the world. He's a freak athlete. He's got range of motion and strength that a lot of average people will probably never have, right? Because if we all did we'd all be Kyle Berkshire, right? Well, there's some things we can learn from Kyle, some positions or some feels and some moves that he does that help him hit the ball that far. Okay, the first one, wider stance, right? So we're talking about wider stance. We're talking all about perspective. So if your stance is usually shoulder width, right, directly shoulder width apart, take a little half step either way on your feet, okay? Well, that's going to help you do wider stance, gets you lower to the ground, gets you in a more athletic position, and then you start using the ground better. You start using your ground forces, getting into the ground, and it makes swinging that fast a lot easier. Next thing we're going to do, we're going to focus on weight shifting more into our trail side. So again, all relative, right? So if you already turn, get really, sway really far onto your right side, maybe that's not a good feel for you, but you can always experiment with it. You can focus on getting that turn deeper, right? So more behind you instead of just to the side. We're gonna work on getting deeper and more bigger backswing. Second thing, same thing, fuller turn, right? So bigger weight shift, and then really focusing on whatever range of motion is available to you, okay? So if you're already kind of limited and you're not making a full turn, just feel like you're going to as much pain-free range of motion as your body will give you, okay? Next one, high hands. This is most likely, it's kind of the key to how much speed this guy generates is how high his hands are. So if you think about it, if you bring your hands up over your head and then drop them low, you're creating an arc, right? It's not just a straight circle up and down, it's now arced, okay? What you're doing is you're creating a longer time, a longer opportunity for you to apply force to that golf club, to really accelerate that club head, and to really, crack the whip, as they call it, cracking the whip. So really loading that club and then just firing it right at the golf ball. Okay. Second or fifth thing, get into the ground, right? So you talk to Brandel Chambly, talk about how he uses the ground, how he uses his ground forces. And really, he's getting into the ground because he's getting ready to jump. So on his downswing, he's bending and loading and really getting ready to then apply vertical force to the ground and jump. And the last one is jump, right? So we're talking about relatively jumping. So if you're someone that tries to feel like you're just pivoting to your left off the golf ball when you follow through, you're just kind of coming out the backside of it, feel like you're going more up, right? Not so much your head's popping up, but you're straightening that leg out. You're trying to apply vertical force to the ground. And if we do all these things, if we widen our stance, feel like we're making a bigger weight shift, feel like we're making a full turn, get our hands feeling like they're higher, right? So if you're really flat, you're probably going to feel like your hands are over your head if you just bring them up 2 inches, but just feeling like your hands are higher, right? On the downswing, really getting into the ground, really using the ground, and then jumping out, right? So you're jumping, applying a lot of ground forces, using the biggest muscles in your body. The biggest joints in your body are your legs, right? So you're really using your legs, really using the ground forces and generating long power. So where do we come in, okay? Power screens. So in TPI, we have most of our athletes and most of the clients that we see are going to fall into 2 groups, and we call them gorillas and gazelles, okay? The gorillas, they are athletes. They are people who don't need any more muscle. They don't need to be bigger. They got plenty of fast twitch muscle. But as Tyler talked about, they don't have any mobility. They're tight. They don't move well. They don't rotate well. They don't really know how to do anything except for lift weights, right? Those basic motor patterns. You're not doing a lot of rotation when you're lifting weights, right? Doing Olympic lifts, you're not rotating, right? You're not doing the things that golf requires you to do. So for our gorillas, we work on mobility, we work on coordination, we work on timing, we work on sequencing, right? And if you don't fall into this category, more often than not, you fall into the gazelle category. So our gazelles are our athletes who are agile, mobile, fast, coordinated, not very strong, right? They could use a lot more muscle. They could pick up a lot more speed and generate a lot more force if they had more muscle. So with these athletes and these clients, we work on getting bigger, putting on muscle, and in the right places, which is also really important, right? So if you don't develop any kind of muscle imbalances or you kind of train incorrectly for golf, it makes golf a lot harder because more often than not, you're actually decreasing a range of motion in a joint that, or in a part of your golf swing that actually made you a really good golfer, right? So being screened correctly and being trained correctly is really important on building muscle and optimizing and becoming your best golfer. So what kind of programs do we offer, right? So we're talking about power, we're talking about hitting the ball further, we're talking about sequencing, mobility, stability. This is a lot of information. So what do we do about it? So we broke our programs down to 6 weeks. So we really feel that 6 weeks gives us an opportunity, A, for your body to adapt, right? So anything shorter than that, it's really hard to see any real physiological change to your body. So if we're doing strength training and you're trying to put on a lot of muscle, or you're trying just to get bigger, faster, stronger, it's hard to do it in less than 6 weeks. You're not really going to see a lot of physiological changes in your body until the 6 week mark. So the 6 week program is 2 screens. So we do full screening. We do the TPI screen, we do the SFMA screen, we do power screens, fitness screens. But that's with one caveat, right? So if you come to us and you're in pain, we're probably not going to do a power screen. We're not going to do a fitness screen, right? We're going to take care of that pain first. That's priority number 1, is playing golf without pain. And that is, I think for Tyler and I both, that is our first priority, is to get people to walk or ride, whatever your preference is, a full 18 holes without pain. And then we build from there, right? So the first package is one-on-one, 1 weekly session. So 1 time a week, one-on-one with Tyler or I for an hour. And with all these programs, no contract, right? The 6 week performance program, the big thing and the thing that Tyler and I are really excited about is that registered dietitian appointment, that nutrition appointment, and the meal planning. If you're really an athlete or a client that really wants to focus on building muscle or even being more mobile, right? You got to put the right things in your body to be able to fuel the machine. And that's what our bodies are. They're machines. When we talk about biomechanics, it's all the same stuff, right? So the Performance Plus program, same stuff, except twice a week, and the meal plan. And then the last one's the unlimited program, right? So this is 2 screens, fully customized programming, the meal plan, all that fun stuff. And then daily, if you like, one-on-one training sessions. So 6 weeks, 5 days a week, 30 visits, 30 one-on-one sessions with us. And those, go outside the 6 week mark, plus or minus. If you missed one, we're cool on that. So with that being said, that kind of concludes our programming. So we're going to turn back over to the Q&A, and then Tyler will get back on here, and we'll try to answer you guys' questions as best as we can. Right. So Don asked, let's see, what tips do you have for a senior golfer who's beginning to lose flexibility, distance, and swing speed? So I'll tag that first, Don, and then I'll let Tyler kind of talk about if I miss anything. So one of the things that we really believe in is that it doesn't matter if you're 30, turning 31, or 60, turning 61, there should not be a reason that you lose distance, flexibility, or start playing with pain, right? Proper training and proper coaching, and even proper programming, right? So coming one-time program, getting a good regimen going for what works for your body is what's going to take. So we can work on swing speed and fast twitch stuff, but when you're aging, you don't really build fast twitch muscle. So we focus mostly on mobility, right? So mobility, flexibility, and then stability, and also in the right places. When it also comes to, you said distance, we didn't talk about this during presentation, but equipment is a big thing. Sometimes that shaft's a little too stiff. Sometimes getting properly professionally fit into a new golf club that is actually is a little more conducive to how you're swinging the club now is definitely recommended. So Brady asked costs. So I will drop our contact information in the chat. So we'll get to that, and then you can email us. We'd be more than welcome to have you to send you a cost sheet and all that fun stuff. All right. In the chat, okay. So Barb asks, I broke my scapula last New Year's Eve. I now have a titanium plate and 8 screws. How will it affect my golf swing at which time? So Barb, I'll ask you if you want to respond to me here. Which side was it? Because that kind of depends on the scapula can match a little different depending on if it's your trail side or your front side. Left. Okay, so are you a right-handed golfer? Perfect. So it really depends on where you broke it, right? But as you think about the golf swing, that left arm, as it kind of comes across the body, right, you're putting that whole section on stretch, right? So you're really, all those muscles that attach from your spine to your scapula get put on stretch. And what we really want to work on, or really recommend working on, is that range of motion, that flexibility, and not too much the shoulder, not so much this range of motion, but like the scapula. So scapula kinematics, how your shoulder blade moves and rotates on your back and through the golf swing. So over time, if you had trauma like that, it might get a little tighter, and you might not be able to get the club as high or as far back as this way. You might start bending that left elbow a little bit, that trail elbow. Bending it a little bit will actually help put that, like, make a full backswing still, but not put so much stress on that front side scapula. All right.
And then also on Barb, on that, I mean, that's what the screen really identifies to us. Again, it kind of all goes back to the sequencing. Yes, I mean, there might be some limitations that you have, but I think if you really can understand how that sequencing works, that's what's so great about golf. Again, you don't have to have the Tiger Woods golf. If you do have to use more hips or more thoracic rotation to get that left external rotation, as Darren was talking about, to get your kind of hips around the ball, that's what's super nice to identify those kind of faults or those limitations, is because usually a lot of times it's not just the scapula that's lacking, it's that thoracic the thoracic that actually is connected to the scapula in many ways, shapes, or forms, and even the cervical and the elbow. So kind of just really being able to break those down and having an understanding that, okay, well, you might lose some limitation here, but there's other ways that you can kind of pick up that range of motion or that power to compensate for that titanium plate or the 8 screws, if that makes sense.
All right, so the next one here, I'm going to take one more in the chat here, then we'll hop back over to the Q&A. Let's see. Doug asked, what are some basic stretches you recommend? So from a golf standpoint, obviously it's specific to the person, right? So if you have any orthopedic history, any injuries, or I'll go generalized male and female, right? So generalized male, hamstrings, posterior chain, glutes, back paraspinals are usually really tight, right? Forward posture. So we really want to focus on elongating and really stretching the back muscles, but also in 3 dimensions. So you can do like a doorway stretch, but kind of lean left and right and kind of bias that stretch to the left and the right to really kind of target those back muscles. And back is pretty much what I stretch out the most from anyone. The highest rate of injuries in golf is back injuries. So taking care of that back and going through the ranges of motion of the back is really, really important. You got anything?
Yeah.
Yeah, I mean, just like you were saying, I mean, you have an upper cross syndrome and a lower cross syndrome, and those kind of depends on what you've done for your career or what you do as a hobby. I mean, that's just something very simple to kind of look at your own body type. Are you in a seated position all day? Then for just like he was talking about, those hip flexors are going to be super, super tight. So basically doing the complete opposite of what you do all day, every day is a really good way to kind of stretch out and open up your thoracic, open up that lumbar, open up the hips, and really get those kind of moving. So that's a kind of good way I really like to look at it, is do the opposite of what you do 8 hours a day. If that makes sense. I think that's a really good kind of baseline of where to start. But again, just like Darren said, it's hard to kind of just give an average stretch to, the person who's just looking for stretches. So, yeah.
All right, so back to the Q&A section here. Joel asked, how did Jordan Spieth gain 12 to 15 miles an hour ball speed? So we talked a little bit about kind of Cal Berkshire, kind of some of his moves he did. So Jordan's old swing, so it was really accurate. When he won the Masters, he had the best short game in golf. I mean, he's up and down from 30 yards all time. He's the best putter from 10 to 25 feet, pretty much ever in the PGA Tour history, right? And that's what it took for him to be the best. What happened is he didn't hit the ball very far, okay? And once you don't hit the ball very far and that short game kind of starts to leave you is when golf gets pretty tough, especially at that kind of level. This time the guy's the best in the world, right? So what Jordan did is he really refocused on speed. So we talked about the Cal Berkshire moves. Jordan's hands and his swing are now a little higher. he gets into the ground a little more. He really works on rotating, and he's got a little more vertical force in his swing. He used to be a really rotary golfer, so it was just around his body. It's really hard to generate a lot of speed doing that. So if you watch his new swing now, he actually gets a little bit up on the ball. His hands are a little higher, and he uses the ground a lot better. So the ball speed comes from swing speed. So as far as equipment goes, I don't know if he made a bunch of equipment changes. He might have changed a shaft or a head or changed golf balls or something like that. But most of it's going to come from an increase in club hit speed. All right, Shaq. So I have a generating disc between L5, S1 and the low back. I play around the golf, and sometimes I have pain. That's tolerable. Other times I have to have pain pill to cut the pain. Okay. Can you set me with a program to help me not cause more damage to my disc and play golf longer? You do have a golf coach, which is perfect. So Tyler and I, we know a lot about the golf swing and swing kinematics, but that's not our job. So we focus, on the body, biomechanics, how the body moves, and how it relates to golf swing. So with 100%, yes. Depends. I will tell you, Shaq, that no one has a regenerating disc, right? So none of us are getting younger. All of our discs are dehydrating and are deteriorating. That's just life. So definitely finding a program and building a program around that pain and what you want to do with your life is definitely a feasible thing.
Yeah. Then also on that, Shaq, we like to get in communication with the golf coach. So as you are working with your golf coach, we like to know what the golf coach has you working on. So if it is something that if he sees example of, again, let's just go with limited internal rotation on the hip, which happens a lot of time with lumbar injuries, you're going to do, I don't know, just for example, sliding is a very common theme. So if you slide and we don't see that because we're doing more of a physical screen, and we get in communication with your golf coach, then that's a really good way to collaborate with your golf coach and then have a physical coach, which again, we believe is the most important way and the best way to get better faster is having two coaches kind of diagnose what's going on and having those two coaches work together. So again, absolutely. Yeah, we can definitely, work on stability and mobility and making that swing, proper. So yeah, definitely we can help out 100% on that.
All right, looks like the last question we have. We got no one. Perfect. Shaq, I just I put our email address. The best way to contact us. That email goes to both Tyler and I. We both see that email. So it's just golf@irgpt.com. Is the best way to get in contact with us. So Ron asked, my practice swing is perfect tempo and form. When I address and actually hit the ball, my body does not cooperate. Can you teach my body how to mirror my practice swing? So that is a problem that I think most of us have experienced from time to time, right? The tempo, the sequence, even the sequencing is perfect on our practice swing and not so perfect on the the real swing, right? So what kind of happens is it's mostly psychological. So from what I've learned in the research that we've done is you see ball and you want to get back to the ball, right? So you turn, you make your full turn, you to the top, and then first thing that happens is you pull in that shaft, right? So the shaft moves first. As Tyler talked about, really, if you watch like a 3D graph of like how the body moves, it's hips, back, arms, shaft. So what I really work on is less about tempo in the practice swing and more about the sequencing in which you're starting your downswing. So more about take it to the top, kind of pause it a little bit, and then let the hips go first, and then let everything fall into place. And you might, the tempo will probably be better, and more importantly than tempo, the sequencing is better because you have the best tempo in the world, but if you start pulling that handle quick before the hips start going, it causes a lot of inconsistencies in the golf game. All right, perfect. Chelsea asked, what's the best tempo drill you suggest? So I personally, for tempo, as far as drill goes, just with your golf clubs. Hold two clubs in your hand and try to swing them. You can't swing them fast. So double the weight in your hands. Obviously do it in a safe place where you have a firm grip in both the clubs and no one's in front of you just in case. But two clubs in your hand and really feel the weight of the clubs and how really because you can't pull on the handle, right? There's a lot of weight at the top. You can't just throw it because it's impossible. So you have to use the right sequencing and the right tempo to swing both those golf clubs. The other thing that I personally love is it's called an orange whip. They're about $100, but they're really worth the investment, at least for my golf game and for me, because it's It's a shaft that's bendy with a weight on the end of it. So you can't swing it fast because it's just going to bend, right? So definitely with no purchase, the two clubs definitely for me.
Yeah, and Chelsea, there's a lot of great tempo drills, but one that I recently saw that has you kind of line up 4 or 5 balls and you just hit the first ball, and with your tempo, I love this analogy. There's little things that, you know, people put on their desk, and they're 5 marbles, right? And if you pick up a marble and you just let that one drop, it's going to hit through all those other marbles, and it's going to bring up the other marble, and it's just going to kind of go back and forth. So a really good rhythm drill and a tempo drill is if you can line up 5 balls in front of you and just kind of get into a good rhythm of that kind of that ball knocking or the marbles knocking, and just go to the next one, follow through, come back nice and smooth, step up to the next one, just back and forth. I think that's one of my favorite tempo drills that definitely helped me out a lot.
All right, and then in the chat, Doug. I was muted. So sorry. Doug in the chat asked us to address the concern about COVID, which I completely understand, right? Most of our screens, actually all of our screens, except for maybe the power and maybe the fitness one, do over Zoom, right? So if you're looking just for mobility and all that stuff, a customized program for stretching or mobility or exercise, right? Zoom is definitely a feasible option for a lot of people. We can do our full screens over Zoom. We can do the SFMA screen over Zoom. As long as we can see you and talk to you, we can get a lot done. All right. Perfect. Well, that looks like the end of the questions. Awesome. I really thank everyone for showing up. Tyler and I are really excited, really fired up about golf. Just being, having clients, teaching golf. Teaching is kind of the reason we started in the profession in the first place. Treating patients, anything like that, and we look forward to reconnecting with you all eventually. So,
thanks, guys.
Thank you so much.